That small change, let's go ahead and kick off the rest of our morning with Dr. Steele. Dr. Eric Steele is Vice President and Chief Medical Officer with the Eastern Maine Healthcare System, where he's been since 2005. We talked a little, and he's going to tell you more, but Maine is a lot different than New Orleans or other places, and it's a little few clinics and doctors spread out over the whole half of the state. And he's going to tell us about his work there. And one of his signature programs has been the Zero Defects program. So all of us get inspired to strive for zero defects. I was talking to Dr. Steele. He's a graduate of Bowdoin undergrad, and my niece and my brother-in-law both went to Bowdoin. My brother-in-law is a psychiatrist, and my niece, pre-med, just got accepted into med school. So it's a great school for pre-med. And Dr. Steele is board certified in family practice, and so welcome.
Thank you very much. Thank you, everybody. I'm really excited to be here today. This is a test of your ability to take direction. At the end of the table next to the center aisle, you should find a stack of papers that looks like this. If you would just make sure that everyone in your row has one, and if there are any extras, if you would pass them forward so we can make sure everybody gets them. I left some on the rows in the back as well. So my presentation today, Zero Errors, Setting and Achieving the New Standard in Patient Safety and Quality Through Performance Hardwiring, represents a commitment that we as a system undertook late in 2007. When we set as a vision to be the best rural healthcare system in the country, and when we went through the exercise of saying, well, what the heck would that look like, we said we think we would have zero errors in what we thought were the most important processes of patient care. So that's where this all started. A little bit about us. We're a 7-hospital system, about 8,500 employees, about 30-plus companies. We're spread across the northern two-thirds of the state, an area the size of Pennsylvania. We have about 85 physician practices spread across that geography. We do everything from a 40-bed critical access hospital and nursing home to a 400-bed tertiary center and a tertiary psych center. So pretty broad geography and range of services. So the formal objectives today: designing a system that targets zero errors, ingraining the zero error approach into the corporate culture, the way we do things, using the EMR as a tool for eliminating errors, and then some case studies in getting to zero in hospital quality and safety. So that's the kind of formal set of objectives. But the real objective is to show our version of the real-world application of Six Sigma goals in quality and safety and patient care through a trial and error process that now in our organization goes back about 5 years. So I'm not going to cover those topics sequentially. Rather, I hope you'll see them kind of baked in throughout the presentation. We're going to go at like warp factor 6, Mr. Sulu. There's a lot to cover. Want to save some time for questions. I'm happy to provide more information and discussion, copy of slides, any of this stuff that you would like. Just find me somewhere afterwards. So 3 basic concepts that if you fall asleep after these, you'll at least have the core of the presentation. I won't take offense. Number 1, set zero errors as the real goal for most quality and safety initiatives, and then redesign core processes for zero error performance. Start with a goal of zero. Number 2, use a rapid, stepwise transition to progressive hardwiring of desired performance into the processes of care as the way to zero errors, because education and data feedback are great, but will almost never be enough to achieve outstanding performance. You have to give up this pipe dream that we've carried with us for so many years. And in general, you must hardwire quality and safety processes to achieve high levels of performance. And number 3, track your performance by counting numbers of actual errors and not percentages and comparisons anymore to external standards. Just measure your performance against the standard of zero errors. So why zero as a target? This is kind of the case for cultural change. There are lots of reasons not to set zero errors as a goal. No one has done it in healthcare. That's changing. seen as an impossible goal that sets us up for demoralizing failure. When you keep coming back and you don't hit it, everyone gets demoralized and kind of gives up. People look at you like you're not perfusing above the neck. You got to be crazy to try to do this in healthcare. Patients may not be compliant, so we can't get to a goal where they're part of the equation. So I'd like to tackle each one of those, or some of those in sequence. So why 0 and not 98%? First of all, anything less than 100% may be a lot of errors. Second, we found that if the goal isn't 0, there's often no real goal. Well, it's 95%, but often no real goal. 0, we found, is the only goal that's really consistent with our values and expectations. It has changed how we think about process improvement and what we're willing to do in process improvement to get there, and more data that it's possible. So each one of those. So this is a little math break. Anything less than 0 may be a lot of errors. So if you have 2 errors in 100, 98%, it looks fabulous. But if you, for example, are screening patients for DVT and pulmonary embolism risk and admit 20,000 patients annually, a 2% error rate is failing to screen 400 patients a year for a potentially deadly complication of illness and hospital care. So a 2% error rate in a common process can be a lot of errors. And if you're a 400-bed hospital administering several million medication doses a year, a 2% rate is extraordinary.